Is your 6-year-old still wetting the bed? Do you feel like you've tried everything only to wake up frustrated and dealing with yet another load of laundry? Are you secretly worried this will never end? Hey everyone, and welcome back to the Three Koi Fishes channel. Our team is made up of parents with over 80 years of combined experience. We personally research and vet ideas, then use AI avatars to present our findings. To be clear, the underlying expertise and research are completely human. We strive to empower you with informative content to help your child thrive. Today's topic is one of the most stressful for families: how to help kids stop bedwetting. We know how isolating this issue can feel, but there is a clear, expert-backed roadmap. We've done a deep dive into an excellent, science-backed resource from the Child Mind Institute, summarizing the powerful advice from clinical psychologist Dr. Kirmayer. We're going to break down the medical checks, the 2 types of enuresis, and the non-shaming, proactive skills that can lead to dry nights. Let's start the main video. Let's start with a definition, because knowing when to seek help is half the battle. While wetting the bed is common in young children, the issue becomes clinical if it persists after a child's 5th birthday or if they start regressing. The clinical term is enuresis. According to Dr. Kirmayer and the Child Mind Institute, a diagnosis applies when the wetting happens at least twice a week for 3 months or longer, and the child is at least 5 years old. It can be voluntary, meaning on purpose, or most often involuntary. Can you relate to feeling frustrated that nothing is working? We need to shift that mindset, but first, we need to take one crucial step. The experts are crystal clear on this. Before you start any behavioral intervention, you must talk to your pediatrician. Bedwetting can be a symptom of underlying, treatable medical conditions. We're talking about things like 1. Chronic constipation, a surprisingly common cause. 2. Sleep apnea, which can disrupt deep sleep cycles. 3. Urinary tract infection, UTI. 4. Hormone imbalance, or 5. Diabetes. If you try to solve a behavior problem that's actually a physical one, you're guaranteed to fail. Always, always, always start with your doctor. Once medical causes are ruled out, we look at the type of enuresis, because one size definitely does not fit all when it comes to treatment. There are 2 types of enuresis, primary versus secondary. First, we have primary enuresis, where the child never achieved consistent dryness. They've been wetting since babyhood. This is usually a pure skill-building issue. Then there is secondary enuresis, where the child was dry for at least 6 months, but then started having accidents again, a regression. If this happens, you need to be a detective. The next important distinction is to determine if the bedwetting is voluntary or involuntary. Dr. Kirmayer stresses that this is where parents need the most guidance. Treatment must align with intent. First is voluntary, on purpose. Bedwetting, which is rare, but if it's oppositional, treatment focuses on positive reinforcement for desired behavior. Second is involuntary, can't control it. Bedwetting, which is the majority of cases. The message here is critical. Shaming, blaming, or using disciplinary methods is unfair, unproductive, and potentially harmful. For involuntary wetting, the focus is 100% on skill building and body awareness. If you're seeing daytime accidents or regressions, the problem might be rooted in the outside world. Is your child anxious? Maybe they don't want to use the bathroom at school. Are they highly distracted or impulsive? They might be so engrossed in an activity they simply forget the urge. Or are they under significant stress? Addressing these triggers might solve the issue faster than any other intervention. If you're committing right now to making this a skill-building journey, hit the like button. That supportive energy is exactly what your child needs. If you have an involuntary wetter, Dr. Kirmayer outlines 2 proven pathways to success. Many families use them together. First up is Pathway 1, the bell and pad technique, the alarm system. This is the classic treatment for nighttime wetting. It's a sensor that goes off with a loud alarm the instant it detects wetness. The goal is to condition the child to wake up before the alarm, or at least stop the stream and get to the toilet. Dr. Kirmayer cautions that while effective, the alarm doesn't teach prevention, it only responds after the fact. It takes a huge parental commitment and often requires several months of consistency. However, for some children, the process itself creates a powerful positive placebo effect simply by increasing their bladder awareness. Next is Pathway 2, proactive bladder training, the skill building. This is Dr. Kirmayer's preferred starting point because it empowers the child. It's all about teaching body awareness. Step 1 is learning and analogies in a neutral, fun way. Explain the bladder. Frame it as a muscle that can be controlled. You can use the fun analogy of a water-filled balloon to show how the bladder expands and contracts. This immediately shifts the conversation from failure to learning a cool new skill. Step 2 is about tracking and training. Spend a week tracking your child's urinating patterns, fluid intake, and diet. Then, dedicate a weekend to bladder training. Dr. Kirmayer suggests making it a whole family game to remove pressure. This involves 1. Mindful urging. Practice filling the bladder, then having the child rate their urge level. They learn to recognize the difference between a little urge and an intense, got-to-go-now feeling. 2. Generalizing the skill. This skill building is the most important part. Dr. Kirmayer says, the skills training exposure and practice really has to happen in the daytime to see it generalize into the nighttime. If they're deep sleepers, they have to build awareness while awake first. Let's finalize the plan with a look at medication and, most importantly, the parental mindset. Yes, medication exists, but Dr. Kirmayer makes a great point. It's like taking a Xanax before a plane ride. It won't cure your fear of flying if you don't eventually fly without it. Use medication only for short-term events like sleepovers or camp when a guarantee of dryness is essential. It is not a long-term solution. I get it. Waking up to a wet bed is frustrating, and it's hard to hide those feelings. But you must. Dr. Kirmayer emphasizes that shaming will only increase anxiety and cause regression. Your job is to model distress tolerance. After an accident, give them something positive to focus on. Have them change the sheets or put them in the laundry basket without prompting. This keeps them active and invested in the process. The message must always be, it's no big deal. We're still working on it, you're going to get it. What's the hardest part about dealing with an accident in the morning? Tell us in the comments. Let's build a supportive, shame-free community together. Dealing with enuresis is a journey, not a switch you can flip, but by ruling out medical issues, understanding the cause, and proactively building body awareness, you can create a stress-free path to dryness. Our sincere thanks to the Child Mind Institute and Dr. Laura Kirmayer for this invaluable expert guidance. If you found this expert advice helpful, please give this video a thumbs up. And I ask that you consider subscribing to the channel to help promote it and support us in creating more research-vetted content to help your child thrive. We have links to the original Child Mind article and other resources in the description box below. See you in the next video.